Topical steroids are a group of drugs that are applied on the skin. They act as an anti-inflammatory agent and are commonly used for eczema and psoriasis. Topical steroids are the mainstay of topical therapy for psoriasis in conjunction with emollients.
Topical steroids are divided into low, medium, or high potencies. Potency refers to the amount of vasoconstriction that the steroids produce. Accordingly, it reflects the amount of anti-inflammatory effect and the potential for side effects. Potency depends on the body area, severity of skin condition, and age. Super high or high potency steroids, in groups 1 through 3, are given for areas with thicker skin, for example on the palms of the hands or the soles of the feet, thick plaques on extensor surfaces such as the knees and elbows, the scalp, and the external ear canal. Very low potency steroids, in groups 6 or 7, are given for areas with thinner skin, for example, the face, eyelids, neck, body folds such as armpits or gluteal cleft, or the genitals, although sometimes higher potency steroids can be used for a brief period such as a week. Steroids are available in several formulations such as creams, lotions, ointments, gels, foams, and sprays. Ointments are typically the most potent and are best for thick hyperkeratotic lesions, fissures, and areas with thick skin such as palms and soles. Creams and lotions are best for moist areas. Lotions are best for large areas, and gels, foams, solutions, and lotions are best for hairy or oily areas like the scalp. The least potent steroids are group 7, which include hydrocortisone 0.5 to 2.5%. Group 6 steroids include desonide 0.05%. Group 5 steroids include betamethasone valerate cream 0.1% and hydrocortisone valerate 0.2%. Group 4 steroids include triamcinolone cream 0.1% and mometasone furoate cream 0.1%. Group 3 steroids include betamethasone valerate ointment 0.1%, amcininide cream 0.1%, desoxymetasone 0.05%, and triamcinolone cream 0.1%. Group 2 steroids include betamethasone dipropionate cream 0.05%, fluocinolone 0.05%, mometasone furoate ointment 0.1%, amcininide ointment 0.1%, and desoxymetasone 0.25%. Group 1 steroids include clobetasol 0.05%, betamethasone dipropionate ointment 0.05%, and halobetasol propionate 0.05%. Topical steroids should be applied correctly. 1 fingertip unit, or FTU, is classified as an amount of the cream or ointment from a 5 mm diameter nozzle from the DIP to the tip of the index finger, which is about 0.4 grams in women and 0.5 grams in men. A child aged 4 should have approximately 1/3 of an adult amount, and an infant from 6 months to 1 year should have approximately 1/4 of an adult amount. The FTUs needed to cover the body parts are the following: 1 FTU for one hand, 2.5 FTUs for the face and neck, 7 FTUs for the front trunk, 7 FTUs for the back trunk, 3 FTUs for one arm, 6 FTUs for one leg, 2 FTUs for one foot, and the entire body should be about 40 FTUs. For example, if a woman applies a cream to both hands once daily, she will need 2 hands times 1 FTU times 0.4 grams, which is 0.8 grams daily. If she is using this for 4 weeks, she will need 0.8 grams times 28 days, which equals 22.4 grams, so she will require a 30-gram tube. Steroids can be applied before or after moisturizers. Pat the skin dry and apply a thin layer until it is no longer seen. Applying topical steroids immediately after a shower or bath may optimize absorption. Patients' adherence to topical treatments should be evaluated. Asking about the frequency and dose of a topical treatment, as well as any concerns over side effects, can identify possible underuse and areas for improvement. Patients should be educated on the chronic nature of atopic dermatitis and the possibility for intermittent therapy for relapses. The potency, frequency, and duration of the steroid therapy should also be reassessed.